A senior pandemic advisor has called on the Hong Kong government to consider putting the entire city under lockdown. Hong Kong University professor Gabriel Leung warns of a severe spike in daily cases next month. The financial hub is battling a record surge, triggering hours-long queues at virus testing sites. The healthcare system has also been pushed to the brink. More than 90% of hospital beds are full. Deborah Wong with this report.
Like mainland China, Hong Kong had stuck to a strict zero-COVID strategy. But the fast-spreading Omicron variant has put this approach to its toughest test yet. With over 4,000 infections reported over the past 2 weeks, up from just 2 in December. In the worst-case scenario, Hong Kong's top pandemic advisor, Gabriel Leung, says the city could see up to 28,000 daily cases in mid-March. And the risk of death could go up by 50% if the healthcare system becomes overburdened. But if Hong Kong imposes a citywide lockdown like in parts of China, he thinks it can tamp down the numbers and return to zero infections.
What we need is to really reduce cross-infection. And the sure way of doing that is to reduce mobility and mixing. And you need to sustain that for as long as you need to bring the number of seeds, infected seeds or transmission chains in the community down to such a level that they will just fade away naturally.
Professor Leung says a lockdown can reduce the strain on mass testing exercises the city has seen over the last month, with long queues at coronavirus testing centres and isolation facilities.
If Hong Kong sticks to its current testing strategy, we must expect to see more of such exercises like this. I'm at a mobile testing site in the financial district at the moment, and you can barely see the end of the line. In fact, residents in the line are telling me that it takes about 2 hours to get tested. And this is a similar picture all across the city, but with an increasing number of untraceable cases. How sustainable can this be?
Hong Kong leader Carrie Lam has said the city isn't able to try to live with the virus, as more than 50% of the elderly have not been vaccinated. And the government has responded to the latest surge with its toughest measures yet, including banning public gatherings of more than 2 people and restricting gatherings in homes.
It may well be necessary because of the spike in cases, but it is going to start to generate resistance. Housing estates get locked down, and then these people lose their job. And that creates economic resistance. People, particularly those in the lower socioeconomic groups, are really being squeezed as to their economic resources and their ability to provide for their families, which is a major concern.
The government has pledged to protect workers affected by lockdowns by making it an offence for employers to fire them. But in long term, some experts argue that Hong Kong needs to have economic and policy measures to deal with such disruptions, even if it's still not ready to abandon its zero-COVID strategy publicly.
In practice, the fact that they have announced that close contacts can now isolate or may soon be able to isolate at home, and that asymptomatic COVID patients do not need to be hospitalized. They only need to be isolated or quarantined in government facilities. That is an indication that they are moving to some sort of adaptation to COVID-19.
Chinese officials have warned Hong Kong that a deviation from the zero-COVID strategy would be a disaster for the city. And the Carrie Lam administration has stated that reopening the city's borders with the mainland is their priority. Deborah Wong, CNA, Hong Kong.